Can you believe we are already here studying muscles? You already know the bones, you already know the joints, the movements that happens at that joint. Let's move the skeleton. We're going to attach the muscles of the body to that skeleton to shake it, to move it. So I have divided the study of the muscles of the body, since they are pretty extensive, into modules. On the first module, we're going to study the muscles of some muscles, not a lot, of the actual skeleton attached to the actual skeleton, and the muscles of the upper limb. On the next and last module, we are going to cover the muscles of your hips and lower limbs. So that's what is left in this lab, anatomy lab. Again, I have included in your modules this list. Please follow the list. In here, you're going to find the muscles that we are going to cover. There's over 600 muscles in the entire human body. We're not going to study all of them, just the most important ones, especially the ones on the limbs. Those ones we're going to cover almost all. Almost. So in here's the list of the muscles. For every muscle, you need to know the origin, the insertion, the action, and the innervation of that muscle, as well as to how to locate it on the body. So for that, and that's the first approach, how you study these muscles. You can make flashcards, your own flashcards. Don't buy them, just make them yourself. The exercise of writing all of these terms will help you set all of this information in your mind. So in one side of that flashcard, you can put the name of the muscle, spelling counts, and maybe a drawing or a copy of where you're going to find that muscle in the skeleton. Not just where, but if it's a superficial or a deep muscle. Then on the back of the flashcard, you can add the origin, the insertion, the action, and the innervation. Add it in a way that you understand that gives you hint to remember all of these items. The other way that you can do is just to do this chart, complete this chart. I uploaded this template, and in here you can organize all the muscles, and this will ease your study way a lot, tremendously. What else? Okay, that's for the muscles. Besides the muscles, we are going to study on these two modules the surface anatomy. And the surface anatomy is just what we see and what we can feel or palpate or touch through the skin. So we're going to put the name to this bony bump in here, to these tendons, we're going to see where is the temporomandibular joint, how to locate it, the sacroiliac joint, the muscles, okay, the ones that can be seen through the skin, because they're important reference points when we are examining a subject, a client, a patient. What else? This is how it looks like, the charts after you complete all of them. In here, for example, I included all the group of erector spinae muscle, and the actions if one of these muscles happen to have a common action or innervation or origin or insertion, I just put it like that so I don't have to repeat it. I just cover, well, these three muscles are innervated by the spinal nerves, for example. And well, several in there you can complete all your charts. Now, buckle up. We're going to blast off to muscle land. But before we get there, you need your passport, and your passport needs certain knowledge that you're supposed to have mastered by now. If you feel that you have some gaps in these concepts, please go back to those chapters, to the PowerPoints, to the video lectures, and review them, because they're, again, is the foundation to understand muscles. Now, I want you to review the the anatomical movements: flexion, extension, adduction, abduction, medial rotation, lateral rotation, circumduction, pronation, supination, inversion, eversion, dorsiflexion, plantar flexion, at every joint. So you are going to, and if you are not comfortable doing that right now, I want you to start, not to start, to be it by now, naming those movements. First, the name of the movement, then the joint where that movement is happening. One. Number two, I want you to go back also to chapter, this is in chapter 11 actually, 10 or 11, where you're going to review the concepts of origin, insertion, action, and innervation. That's our chart. That's what we're going to learn about every muscle. So in any given muscle, remember, let's take as an example, we always do, I don't know why, the biceps brachii. The muscle is attached, it has at least two places of attachments, at least. One is proximal, one is distal. One moves a little bit, the other moves a lot. So the attachment of the bone of that muscle, the one that moves the least, that's the origin. And the attachment of the bone of that muscle, the one that moves the most, that's the insertion. So look at the biceps brachii. See, this one is moving, but just a little bit. The part of the attachment of the muscle that is moving the most is this one, the distal one. Usually it's the distal, but not always. And remember also that at any given moment, the insertion can act as an origin. If we, let's say that I'm going to do a pull-up now, okay? Now the part that is moving, it will be what I consider first the origin. Rule of thumb: insertion moves towards the origin. Insertion moves sorry. The insertion moves towards the origin. The action, and in between the origin and the insertion, usually we have belly. The belly of the muscle is just the fat area of the muscle. That's the belly where we apply the massages, where all the knots of the muscles are. The action is just what the muscle does. Does it flex the arm, or does it flex the forearm? Does it extend? Okay. Usually this is not a rule for all the muscles, but usually a muscle that flexes, for example, the forearm, cannot extend it. Remember, muscles cannot push. I need an antagonist, a triceps, for example, to extend the forearm. So don't mention, usually there are few exceptions to this rule, but don't mention when I'm asking you an action, you say flexion and extension. It's either flexion or extension of what? If you don't tell me of what, wrong. And lastly, the innervation refers refers to the nerve that provides or supplies that muscle. Remember that in order for a muscle to contract, we need a wire that is coming from the nervous system, a nerve, a bundle of axons. Without this signal, this electrical signal, the muscle won't contract. The muscle can be intact, can be in perfect shape, but if the nerves are not working, that muscle won't contract. So we need to learn the nerves that are innervating each of these muscles. Please also remember the clues that the name of the muscles are screaming at you. It's screaming the locations: brachii, femoris, gluteal. They're telling you the region of the body where you're going to find it. The shape, well, this applies to the deltoid. A deltoid is like the Greek delta letter is like a triangle. Teres is like a cylinder. The size, we're gonna see longus and brevis. Longus is longer than brevis, which is smaller. Maximus is bigger than minimus or medius. The direction of the fascicles, remember rectus of femoris, rectus abdominis, the fibers are parallel straight to the and parallel to the long axis of the body. Oblique muscles are on a diagonal. Transverse muscles, the fibers are on a parallel to the transverse plane. Attachments, they're muscles that are so cool because they're telling you at least one attachment or maybe two attachments, side of attachments. Brachioradialis attaches on the brachium, which is the bone in there is the humerus, and radius, brachioradialis. Flexor carpi ulnaris attaches, well, you don't know one, which is on the humerus, but the distal attachment is carpi ulnaris. It's on the carpal bones and ulna. The numbers of origins, these apply to the biceps, triceps, and quadriceps muscles. Biceps has 2 origins or 2 heads, triceps 3, quadriceps 4. Now, you need to be specific when naming biceps and triceps because we have 2 of those. We have biceps femoris, biceps brachii, triceps brachia, and triceps suri. So you need to be specific about that. The actions, some of them are telling you adductor mechanism. What is the function? Adduct what? Well, you're going to tell me depending on the location. And the other thing, the fourth thing that I want you to review, if this is not crystal clear right now, is the action. How can you figure out the action of the muscles depending if this muscle is crossing the joint anteriorly, posteriorly, superiorly or laterally or medially? For that, do you remember? Review this slide, okay? Remember, all the anterior muscle, okay, all the muscles that are crossing anteriorly any joint, with the exception of the knee and the ankle. This applies for everything except the knee or the ankle. So all of these joints, all of the muscles that crosses anteriorly the joint, they can flex, 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 flex. If they're crossing posteriorly the joint, they can extend, extend. If the muscle is crossing laterally, they can abduct. If they're crossing medially, they can adduct with double D. So I think that's, I think, let me check. But I think that's pretty much it. Yes. So these are the basics, like an introduction before taking a dip into muscle land. Have this ready. If you're ready, I see you in the next video. If not, go back, check them out, and I see you in the next video anyways. Really, this is gonna make everything easier, very easy to understand. See you.